Well, good afternoon. This is really a privilege. I grew up in Ventura and went to high school actually down in Carpinteria, so in a way, this is like coming home. So I appreciate that opportunity. I'm not a Bruin. I didn't go to USC, but I did go to Stanford, so Pac-10. Anyway, thank you very much for this opportunity. So I think everyone in the room would agree that trauma is it's a team sport. It's multidisciplinary. There's so many different facets that make up a trauma team, and they're indispensable. If I had my way, I would love to bring my family, my trauma team here to be able to speak with you today. Unfortunately, I can't. So what I'm going to do is I'm going to start off with a video. It's about 9 minutes or so, and it is a video that highlights what happened on June 12th, 2016. You'll hear from nurses, you'll hear from doctors, you'll hear from residents, hospital administrators, and you're going to hear from some of the victims. And so we'll go ahead and play that video first, and then we'll talk some about the lessons learned from the Pulse tragedy.
Sunday, June 12th, 2016. The time, 02:03.
911, what's the location of your emergency?
In the Pulse in Orlando.
My friend got shot in the bathroom.
There's a lot of dead people.
There's multiple people in there.
Shooting, and there's a lot of people dead. He said he can't talk.
I couldn't feel my legs. I tried to get to the exit. I was dragging myself to the exit. I couldn't feel my feet.
The music cut off and it went silent, and all you heard was gunshots. Instantly, I knew right there that this was bad. We're trapped in here. Just as I thought, he came and he started laughing, and then he just started shooting through the door, and everybody fell to the ground like all at once.
Felt heat all over my body, just heat. But I didn't know exactly where I got shot, but I was holding my stomach most of the time.
The last thing I remember, they were carrying me by all the limbs, and they took me into the back of the truck.
3 hours of terror overnight, multiple shootouts, hostages.
Just really can't describe the feeling right now. It's, you know, being back out here, I mean, I haven't stepped on this property since that night. Ones that were showing signs that they were responsive, I would talk to them. I said, hey, I'm here to help you out. Just hang in there, hang in there.
All I remember was waking up in the middle of the surgery room. And I just remember looking back and forth and just seeing blood and bodies next to me, basically. I was trying to take in any drop of air I could get. I remember I was just vomiting blood like crazy. My whole body was just covered in blood.
It was so loud, and I just remember definitely hearing all the doctors. You could hear them, you could hear that they were frantic, you could hear all the patients screaming.
The magnitude of what came in, I don't think that any of us were prepared for.
We see a lot of gunshots and stabbings. This was different in that he had both high velocity and low velocity firearms. And the high velocity carry a lot more destruction of the tissue with them.
You have to not be distracted by the size of the wound and look at how the patient is doing.
This was on a scale far beyond what we ever expected to have to deal with.
I went into the family room and I said, can I have your attention? I said, I'm gonna put my email address up and I want you to send me a photograph of who you're looking for. To constantly see pictures of people, but please help me find my mother. She's the mother of 11. And she's out with my brother. She was out with my brother who's gay. Can you help me find my father, my uncle?
You hear him reading names and conditions of the patients that we had here.
Next, Brian Garabello, critical. Paula Blanco, stable.
You hear sighs of relief. You hear sighs of anguish. I mean, one of the things that we learned was you need to have someone with a clinical background staying in the family rooms because people would faint. When the list was read, we said we have 4 here that we haven't yet identified. And then all the families were like, well, what about mine?
A memory that I will never get out of my head. It's the picture of 5 really clean, white, shiny medical examiner vans. And one at a time in synchrony, one backs up and leaves and goes out to Orange Avenue, and another one backs up and goes out. There's 1 or 2 people in each one of these vans, and it's over just like that. It's 6 a.m. and it's just over like that for them?
Every patient that made it into the OR to have surgery survived. Every single one.
We took in 35 alive, and we still have 35 alive.
No patients have succumbed to their injuries since the initial 9 patients who came to us at the time of the shooting. All of the patients since arrival to the hospital are still with us.
I would say drill. I would say practice. Have a plan, okay? You know, if you fail to plan, then you're planning to fail.
There was a tremendous amount of preparation. There's a tremendous amount of training. I don't know how to explain some of the things that were just the way they needed to be, other than there had to have been some grace. There were the right people in the right place so many times through the night.
To have the outcomes that we did, I mean, it's truly remarkable, truly a work of God and a work of all the team members that came together to help, you know, from EMS to the police to ER to the OR.
I'm surrounded by heroes. I'll never forget this. For the rest of my life, I will never forget what they did.
We immediately made the decision to hold all the bills. And I think it's our culture of compassion in the organization.
One night that week, I went out, got in my car, and it was quiet. Like a wave of emotion hit me, and I realized that, you know, everything that the counselors had been talking about was, you know, for me.
It's when you're quiet and by yourself, that's when things get hard. And honestly, I have been seeing a counselor. It took me about a month to get to that point because I'm a strong surgeon, I'm confident, right? Not really, but you know, I don't need help. That's for the residents and that's for the nursing staff. I was wrong.
The higher I get in leadership, the more I realize that there's hardly anything I can do on my own. The night of June 12th, Orlando Health received 44 victims within 2 hours and performed 28 surgeries. As of today, we performed 71 surgeries on these patients, and thanks to the skill of our clinical team and the grace of God, no patient has died since the early morning hours when this tragedy first occurred.
I think we all struggled with the notion of hate, you know, manifesting in the way that it did. And I think the only way that I've been able to reconcile that for myself moving forward is just, I watched the opposite of that. I watched love and I watched compassion, I watched empathy in terms of how people cared for each other and supported each other and believed in each other. That, for me, will change me forever.
Sarah, come over here. Come.
I can't really.
We all got matching tattoos, and we just put them in different places, but...
We got him across the street from Pulse.
Don't stop being prepared. You know, we talk about disasters, and you've seen a lot across the United States. You've seen a lot across the world. We've got to be prepared as a nation. Are you prepared? Are you ready? And stop the fluff stuff. Stop saying I have some policy that's 13 years old that's dusty on a shelf. As a hospital, you have that obligation. So are you ready?
Oh gosh, we have another drill. You know, in the past, I've had that attitude. We all have that attitude, but it is of utmost importance. Without that planning, we wouldn't have had the chest tube to save patient X that had her chest tube here that now I saw in my office 2 weeks ago that's doing fine.
Everything is considered a blessing now to me. I got a second chance and I don't want to waste it.
I go there for my doctor's appointment, and every time I see it, I get flashbacks, but I get good flashbacks. I don't get like crazy flashbacks or scary flashbacks. I was basically born again there.
So let me take you back to June 12th, 2016. The Pulse Nightclub is a very unobtrusive little building. I drive by it to and from work every day. It's a very small club. You could probably fit, you might be able to fit 6 or 8 Pulse nightclubs in this room. It is small. So that morning, there were 300 people in the club. They were celebrating Latin night. A lone gunman entered the club. He was armed with a AR-15 assault rifle and a 9mm handgun. We can now, that it's out in the public, we can talk about the fact that this was not his target. His target was actually Disney. That, for years, has been what we, as a trauma center, have planned for, that there would be some type of an attack, if it was not a natural disaster, like a hurricane. It would be a terrorist attack at either Disney World, SeaWorld, or Universal, the 3 main attractions in Orlando. And so that is what we had planned for and prepared for. What we had not realized was that we could end up with a disaster 2,100 feet from our door, because that's how far the Pulse nightclub is. A third of the victims who came to us were actually carried up the street by bystanders and brought to our door totally unannounced. He entered the club. This was just a target of opportunity for him because he was unable to get close enough to Disney World because of their security to feel that he would be able to accomplish what he set out to do that morning. So kind of giving up on the amusement parks, he drove through downtown and he finds this club and there were lots of people there, and so he went in and started shooting. He fired about 250 rounds. He fired at anything that moved. When victims would raise a hand and try and get help, he would shoot them again. Just heinous what he did that morning. He didn't realize that there was a police officer there providing security. And so literally within a minute of him starting to shoot, the police officer was trying to find out where the shots were coming from. Once he identified the shooter, started shooting back at him. The shooter kind of went into some other rooms, continued to shoot, eventually was forced into the back of the club, back into the bathrooms, and barricaded himself there with about another dozen or so victims. After about 2.5 hours, the SWAT team blew out the back wall of the club because he was threatening to blow up the remaining hostages, and all told, 49 people died and 58 were injured. So this is the timeline of that morning. He started shooting right at 2 a.m. At 2:10, we got our first victim. It was totally unannounced. We could actually see all the police cars traveling past the hospital, lights and sirens, heading to the club. And one of our nurses that you actually saw in the video, Libby, her husband works for the heavy rescue unit for Orlando Fire Department, and he was on duty that night. And so he texted her and said, "You're going to be getting a lot of victims. There's a mass shooting." So at 2:10, we got our first victim. Victims started coming in at 1 per minute for the first wave of victims that we received, which totaled 36. There were 9 patients that came in that were essentially dead on arrival. We did ED thoracotomies on 3 of those before we realized the magnitude of this event. We called in our entire trauma team. We started opening up our operating rooms. The entire road out in front of the hospital and the club was blocked off. You've never seen so many police cars. And so what we had to do was find a way to get into the hospital, because the only way to approach the hospital was now from the north, because the entire southern part of Orlando below the hospital was now a crime scene. It was completely blocked off by the police, who were still shooting with this gunman. About 3:30, we heard shots in the emergency department, or so people thought. My pager went off as I was in the ED taking care of patients. It said, shots fired in the emergency department. We activated our Code Silver plan. Barricaded all the patients and the team members in the rooms. The SWAT teams had to come through and clear the emergency department, ultimately having to clear the entire 1.8 million square feet of hospital. They knew who they were going after. The police department said, yes, there's no way one person could have fired that many shots. We think we know who the second shooter is. He came in as a victim. We need to find him. They eventually found that patient. It turned out he was not a shooter. He was just an innocent bystander. But for 45 minutes, we were all locked down thinking that there was a shooter inside our hospital. And that had a tremendous psychological impact on team members that has continued to this day. You don't come to work thinking that you're going to have to text your loved one saying, I think I'm going to die. And we had nurses doing that. We had doctors doing that. Something you just never think about. We ultimately were able to clear the hospital, make sure that there was not a second shooter. The SWAT team breached the club at 5:02 a.m. We could hear that explosion go off, and the second wave of victims came in. This was about 9 victims, plus a SWAT team member who had been shot in the head, but luckily his Kevlar helmet saved his life. He actually walked out of the emergency room and went home 2.5 hours later, and we were very thankful for that. By about 6 a.m., we got the word that the third wave of victims that police had warned us about, which was estimated to be another 40 victims, was not going to be coming because they were all deceased. And those are the victims that you saw on the news having to be brought out of the club. So that third wave never materialized. All during this time, we're busy operating on the victims. We're moving them through the system. We're triaging patients out of the ICU and the step-down units to make capacity, getting the patients out. And by 9:30 in the morning, the emergency room is the quietest I've ever seen it. We're kind of looking at each other like, what do we do now? There's nothing to do. And we were actually able to convince the county to allow us to reopen as a trauma center. They had shut us down, put us on divert, because they wanted to just focus on bringing the gunshot victims to us. But by 9:30, we opened back up and we began to receive victims again. At that point, we started talking with the FBI. We said, look, we have about 400, 500 family members in the community. They're outside the doors. They want to know what's going on. Well, you can't tell them anything. This is a crime scene. We said, that's not the way we work in trauma. We need to be able to let families and friends know whether their loved ones are alive or not. And so we talked with the FBI, talked with the county, and about 10 a.m., we got the permission to go ahead and start speaking with families. It was a couple hours later before as you saw in the video, we actually brought all the family members into a room about this size, and we basically asked if we could go ahead and read off the names and the conditions of those who were injured. So in summary, we had 36 victims in the first 36 minutes. We did a total of 29 operations that first 24 hours, in addition to another 13 elective operations that were scheduled for that day. We had a total of 417 team members that came in that morning to help. These were not people that were scheduled to come in. They simply came in when that mass casualty page went out. And we ended up transfusing 441 units of blood in that first 24 hours, a total of 550 units overall for the almost 80 operations that were done. Interestingly, 28,000 units of blood were donated in Orlando in the next 3 days. The blood banks didn't know what to do with it all, but they shipped it all over the country. We had 35 survivors in the 9 fatalities that you mentioned, as you saw in the video. No one who made it to the operating room alive subsequently succumbed. They all survived. So let's talk a little bit about mass casualty incidents. We talk about mass casualty events, and we use that term very frequently. Well, what is a mass casualty event? It's basically this situation where the number of patients that you have exceeds your capability. Okay? It's by definition, it's a chaotic event. It is a little bit out of control. It's a crisis situation. You don't want to be in a mass casualty event. Okay? What you want to do is you want to try and convert your event from a mass casualty to a multiple casualty event. And I would argue that that's actually what we had in Orlando. I think from what I've heard, I think we're going to hear this afternoon, that's really what they also had in Las Vegas. By bringing in enough staff and resources, you're able to take a situation that is initially at risk of being a crisis and converting that into something that's more controlled, where you can have a good outcome. So one of the first things that happened when I got the phone call at about 2:15 that morning from Chad Smith that you saw in the video, he called me up and there were none of the usual pleasantries at 2 a.m. It was, I have 20 gunshot wounds, I need you right now. And I said, I'm on the way. I said, call everyone. Because I knew that with an event like this, with multiple gunshot wounds, almost everybody was going to likely have to go to the operating room for one thing or another. And so I wanted as many surgeons there, I wanted as many operating room teams as possible. And so by bringing in those resources early, I think we were able to convert this to a multiple casualty event. We're used to standard of care. We're used to doing everything possible for every patient. Maybe sometimes more than we ought to. We can debate that in another time. But we're used to standard of care. Right? In a mass casualty situation where you do not have enough resources, you have to drop down into what's called sufficient care. This is where you have to basically ration care. You have to triage patients because you don't have enough resources. And that line that you see will divide that event. The problem is that we're not good about rationing care. Okay? And so the idea that maybe you're not able to provide everything possible to a patient in a mass casualty situation has a huge impact upon your team psychologically. We'll talk more about that a little bit later. The fact is that disaster events like this are increasing in frequency. You almost can't open your phone and read the news without hearing about another mass shooting. Again, we'll talk about that in just a few minutes. But you have to have a plan, as you saw in the video. Okay, Ben Franklin was the one who made the quote that Chad mentioned. If you fail to plan, you're planning to fail. Okay, it's not a new concept. All right? You have to have a plan. You have to practice that plan. You have to plan for various contingencies in order to be able to be prepared, you and your hospital, to be able to have a good outcome. What I'd like to get across to you this afternoon is that the things that are really important are the things that most people never practice, but they ought to be. Now, this was the lessons learned from an American Association for the Surgery of Trauma session that we had back in September. We got about 6 different trauma centers from around the country that had been involved in various events, and we basically said, what are the common lessons learned? And these are what we came up with. The fact that hospital team members may need to assume non-traditional duties in a situation like this. It becomes all hands on deck. And sometimes you might be doing things outside of your comfort zone in order to be able to take care of that increased number of victims. You need to plan ahead and make sure that your hospital has a plan for surge capacity so that if you had a sudden influx of victims, where are you going to put them? What resources are you going to need? What do you have to have stored that you can pull out quickly and be able to set up an alternative treatment area? Once the dust settles, you need to look at all the patients and re-triage them. So the first thing that we did at 7 in the morning was we looked at our master list. We knew that nobody else was coming, and we said, okay, we're going to start from scratch. And we went back and we did the primary and secondary survey, re-reviewed all the films on every single patient to make sure that we hadn't missed anything. You learn how to deal with the media, okay? If you've not had media training, if you're in a situation where you're potentially going to represent your hospital, you need to get some media training and learn how to deal with them, and we'll discuss that as well. And then most importantly, you really need to remember to take care of your hospital staff. And pretty much any hospital that has been involved in one of these events will tell you that the psychological impact on their team members goes on for years and years and years. We still have team members that are in counseling. The hospital in Aurora, Colorado, told me a couple months after the Pulse event that even 5 years later, they still had team members that were in counseling. When we did a study of our surgical residents, immediately after the event, we found that a third of our first and second and third year general surgery residents actually met criteria for PTSD. The older residents, they were kind of used to the knife and gun club. It didn't affect them as much. Thankfully, by 6 months when we re-administered the survey, that had all resolved, and they no longer met criteria for PTSD. But it has an impact on your team. So let's talk about some of the challenges. So I mentioned the Pulse Nightclub is 2,100 feet from the hospital. That, again, was not something that we had ever thought could occur. It's in a commercial area. There are shops next to it. There's a Dunkin' Donuts on one side. There's an auto parts store on the other. Okay? It's just not someplace we would have expected to have an event like this. As I mentioned, most of the victims were transported by either police in the back of a pickup truck or by bystanders. It was only after the scene was no longer hot and there was no longer bullets being fired that EMS was actually able to get into the scene and start bringing people to the trauma center. Most of those victims, therefore, arrived without any kind of warning or handoff. And as I mentioned, the patients arrived at a rate of 1 per minute. So people ask about triage tags. There was no time to fill out triage tags. Okay? Nobody had them out in the field, obviously, until late in the event. We just took the patients and we took care of them as they came in the door. The code silver, as I mentioned, was really, we talk in exercises about wanting to drill to fail. Okay? This was one of those drill to fail events in a real event. Okay? We basically, there for about 45 minutes, thought there was actually an active shooter inside the building. And so we barricaded ourselves in. I was in the trauma bay at the time, and then I realized, well, this doesn't do us a whole lot of good, because now we're all looking at each other and we're taking care of the maybe 6 or 8 victims that are in the trauma bay, but we realized that there were also dozens of people out in the emergency department. And so we actually pretty quickly unbarricaded the doors, and some of us went out to take care of victims, and we re-barricaded the doors behind us. That did lead to significant emotional and psychological trauma, though, and we had to start counseling sessions by 7 a.m. that morning. We have a staff psychologist at our hospital. She came in about 5, and we had those sessions set up by 7 so that the emergency department team that was going off duty at 7 had the opportunity to sit down and have some group counseling before they left for the day. In the first 10 days, we counseled about 1,500 team members. The family, the friends, okay, they all arrived at ORMC. Even though a small number of patients were taken to other hospitals, or they left the scene, got home and realized they were injured, and then presented to another hospital, the media and law enforcement pretty much told everyone, go to ORMC. And so we now had all the family and the friends for all potential victims outside our door. The hospital was on lockdown. We didn't want to let anybody in at that time so that we could focus on the patients, but we became the source of all information for family and friends. And as I mentioned, the FBI initially would not allow us to give out any information. They said, no, we have to interview all the victims first. Then you can start talking with anyone outside the hospital. We had to deal with HIPAA, which is a concern. Now, just so everyone's aware, there is a stipulation in HIPAA that in a mass casualty situation, and this dates back to Hurricane Katrina in 2005, in the event of a mass casualty situation, you are allowed to go ahead and disseminate patient information to the public if it helps you to identify patients or helps you to reunite families with victims. So there is a stipulation in HIPAA that you can go ahead and do that. And the way that we handled that was we got everybody in a room. There were about 500 in the room, very similar to this. And we basically said, this is what HIPAA is. We have a list of all the patients that we have. We think we've identified all but about 4. Is it okay if we read off names and conditions so that we can try and match you all up with your loved one? And everyone in the room started saying, yes, yes, please, please tell us something. We then read off names and conditions, as you saw. That was it. Reunited the families, and then we went ahead and started disseminating more information to the individual families. But this is something that you need to keep in mind if you're ever in that type of a situation. Now, hospitals are secondary targets, unfortunately. That's the reality of the world that we live in. We actually have magnetometers and X-ray machines at ORMC. We've had those there for several years. It predated Pulse. You'd be amazed at the number of guns, knives, tasers, pepper spray that we find every single month, people trying to bring into the hospital. Law enforcement was a huge help. They had always told us in our disaster drills, we're going to be busy elsewhere. We might be able to let you have one officer. That morning, we had more officers than we knew what to do with, which was wonderful because we had people trying to sneak into the hospital. I never expected to see an officer with an assault rifle stationed just outside of our hospital. But it was a huge help that day. What we did realize, though, is that because our Incident Command Center is in the very center of the hospital to try and protect it from hurricanes, it's right underneath X-ray. X-ray has lots of lead. Radios don't go through lead. So the police couldn't talk on their radios while they were in our Incident Command. So we learned some things that day. It would have been nice to know that beforehand. But now when we have disaster exercises, our Incident Command room is completely filled with it's an alphabet soup of federal agencies that all want to participate in the disaster drills because they've realized we need to have that collaboration ahead of time. The media. So you saw the picture on the left where we had about 400 members of the media. This is actually Orange Avenue on the right. That's the hospital in the background. The media pretty much filled and blocked off Orange Avenue, the main thoroughfare through Orlando, for the first week. Couldn't drive up. You couldn't get into the hospital without being accosted by Anderson Cooper. That was the big thing. Then all the nurses and the RTs and the residents wanted their picture with Anderson Cooper. They set up mini TV studios just on the sidewalk outside the hospital. They used long-range microphones to record conversations that were going on inside the hospital. So you need to learn how to deal with the media. The vast majority of them were wonderful, believe me. They were awesome. But we also had them sneaking into the hospital saying that they were family members, and then the first thing we knew about it was when we watched the news last night and we're looking at one of our patients on the news being interviewed in our hospital without our knowledge. Bloodborne pathogens. So many of the victims were exposed to other victims' blood. There is a very nice review that you see listed down there at the bottom. It's from Morbidity and Mortality Weekly Report from 2008. It's about 60 pages all told, but it focuses on blood-borne pathogens in a mass casualty situation. And so we tested all of our patients for hepatitis B. The recommendation was that they be started on hepatitis B vaccination. Hepatitis C and HIV were not recommended unless there was a particular reason. And we made sure that these recommendations got out to not only the victims that we had in the hospital, but also out to the community, so that anyone who had been in the club, was not shot, but had gone home, could see their PCP or go to the health department and get vaccinated for hepatitis B as well. A couple more take-home points. You have to practice. You have to practice. You have to practice. Okay? If you're on a sports team, you don't just go and go to the playoffs, right? I mean, you have to practice. You have to get to know your team ahead of time. And that clearly was huge here. We have drills on a weekly and monthly basis for our trauma team. We've done drills with Disney, as you can see in the upper left. We have a 5-county, 26-hospital drill every April. The bottom left picture is Dr. Gary Parrish, who is the head of our emergency department. That was from the drill 3 months before the Pulse event. The scenario that year was a mass shooting on a college campus. We had basically drilled for Pulse 3 months before it occurred. And the lessons that we learned from that drill were incredibly helpful 3 months later when we had it for real. Incident command is huge. This is kind of the brain center for any hospital that is involved in a mass casualty situation. And I think most hospitals are using incident command now. We brought ours up within an hour. The only reason we didn't bring it up earlier was we simply didn't have enough people. They were so busy taking care of patients. I got there at about 2:20, did 2 operations, and by that point, enough of my partners had arrived, because I live very close to the hospital. Enough of my partners had arrived that I was able to turn the operating rooms over to them. I immediately went and started setting up incident command with our chief operating officer. We ran that for the first 39 hours after the attack, using 2 teams on 12-hour shifts. And so when Chad Smith called me during that break between the first and the second wave, and he said, "I'm out of chest tubes. I need more Pleurovacs. I need chest tube insertion trays." It was a simple matter of me turning to the guy in the yellow vest just to my right and say, "Hey, we need more chest tubes." That's the head of material management. And so he literally picked up the phone in front of him and immediately had chest tubes on their way. We're 3 hospitals on one campus. So we have Orlando Regional Medical Center, we have Winnie Palmer Hospital for Women and Babies, and we have Arnold Palmer Hospital for Children. When the mass casualty page went out, the pediatric surgeon on call at Arnold Palmer called Chad Smith up and said, "Chad, what's going on? You all don't normally do drills at 2 o'clock in the morning." And he said, "This is no drill." And so Mark Levy, one of our pediatric surgeons, said, "Hey, can I come over and give you a hand?" So Mark came over and supplemented the 6 of us that came in that morning. It was a huge help. As we began to realize how many operating rooms we needed, and we realized how difficult it was for our team members to get into the hospital that morning because of all the roadblocks and the police cars, we realized, hey, we've got operating room teams at Arnold Palmer and at Winnie Palmer. They may be used to birthing babies, but we can use them. And so what we did was we brought them over to ORMC. We used tiered staffing, paired up a nurse from Winnie Palmer's L&D with one of our nurses from the operating room, and we were able to rapidly expand the number of operating rooms that we had. So you optimize what resources you have available. You need to develop your relationships with law enforcement and local government now. When Ron Blocker, the FBI lead agent in Central Florida, came into our incident command that morning, handed us his card, and he said, "If I'm having to hand you my card now," he said, "we're already behind the ball. You want to get to know these people ahead of time." We're now on a first-name basis with police, sheriff, fire rescue, FBI, ATF, keep going down the alphabet chain. And those relationships are extremely helpful when you are in need of their types of resources. It's not a matter of having to try and figure out what's the number for the FBI. It's a matter of pulling out your cell phone and hitting Ron Blocker's cell phone because he's already in your phone. And he already knows who you are when he picks up the phone. That was hugely helpful. You want to support your fellow hospitals. So when we have an event like this, the history is that we've usually called Domino's and we send the emergency department at the other hospital a dozen pizzas. Right? I mean, it's just what we've always done. The problem is that because hospitals are now secondary targets, what if those pizzas are tainted or poisoned? Okay, when the FBI saw Domino's delivering dozens of pizzas at a time, they said, whoa, 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 you can't eat those. This is a terrorist event. We can't take that chance. And so we even had these wonderful little grandmotherly types bringing us casseroles that they had made and bringing them to our front door saying, you know, you all need to eat. And we graciously accepted them, but we then had to put it in the dumpster simply because we didn't know whether it had been kept warm, whether it had been cold, whether it could be tainted. All right, it's much better to show your support for your fellow hospitals by sending a banner like this. We had about 20 of these up in our lobby for 3 months. We hated to even take them down. We fell in love with these things because we knew that our fellow trauma centers were out there supporting us. The other reason not to send pizzas is somebody now has to accept the pizzas from Domino's and has to figure out what to go do with them. That person is better off taking care of a family member or taking care of a patient. VIPs come out of the woodwork after an event like this. They all want to come immediately. It's mostly just to get FaceTime. One of the senators from Miami drove. There's no way he maintained the speed limit because he was there for the very first press conference. We had no idea why he was there. He basically forced his way to the front. He just wanted to be in front of the cameras. Okay. The contrast is Senator Bill Nelson that you see there in the picture with Joey Ibrahim and I. Bill Nelson is our senator. He called us up in the Incident Command Center that morning, and he said, "What do you need? I'll get you whatever you have, whatever you need from the government." He said, "I'd like to come and visit, but can I come in about 10 days? Because now's not a good time for you." We loved that. Okay, 10 days later, he came and he shook the hand of, I think, just about every single person in the hospital. But it was a huge boost in everybody's arm at that point. You need to recognize you're going to be affected personally by this. These were the crosses that a gentleman in Ohio made and brought down to us. He did the same for Vegas. There was one for each victim. These were set up on the lake just outside of our emergency department because loved ones and friends could not get to the Pulse Nightclub. It was still barricaded off. And so it's sobering to walk out and see the cross and the pictures and the mementos of the people you couldn't save. Your whole community is going to be affected. This was the vigil that was held 3 nights after the Pulse event, about 5,000 people downtown. To this day, you still see signs up around Orlando about Orlando Strong and about the Pulse event. So let me just real quickly give you a little bit of an idea of what's going on now, just over 2 years later. So on May 8th, the Pulse Club was reopened as a memorial. This was the memorial dedication ceremony. This is what it looks like right now. There's not a time of the day that you drive by this when you will not see somebody outside visiting it or paying respects. This continues to have a huge impact on our community. Coming out of this, we had been working with Stop the Bleed, which is a national program to teach the public how to stop life-threatening bleeding. But after Pulse, the community has just wanted more and more. So we do about 3 to 4 Stop the Bleed events in Orlando each week. This is Chad Smith teaching all of the FBI agents in Central Florida how to do Stop the Bleed. We've also put bleeding control kits in defibrillator boxes throughout the community and at the airport, and we're teaching the public to look for a bleeding control kit in the AED boxes. We've put together a disaster response manual, which may be something that you might find useful, and we hope it would be. You can go to the URL listed here, orlandohealth.com/disaster response, and gain free access to that. It is basically an ebook. It has the video that I showed earlier. It also currently has about 30 chapters from departments throughout the hospital. We recognized that blood bankers would like to talk to blood bankers, chaplains would like to talk to chaplains, nurses would like to talk to nurses. So we got all the departments in the hospital that responded to basically write a chapter on what lessons they learned for their individual department from this disaster response. So I encourage you to take a look at that. So just in closing, I'm tired of updating this slide because I have to do it fairly frequently. The number of shooting events just continues to go up, and it's something that we really need to be prepared for. It is definitely a crisis in the U.S. Our fellow trauma healthcare providers around the world laugh at us at how many gunshot wounds we see compared to what they do. They have much stricter gun laws. One of the reasons that we can't really do much about gun control in the U.S. is because of something called the Dickey Amendment. So in 1996, the Dickey Amendment was passed, and that basically says that federal funds cannot be used to study firearm-related injuries and deaths. Now, it primarily affects the CDC, and it doesn't really prevent the CDC from doing any firearm-related studies, but they have interpreted it as that for the last 25 years or so. And so there have been a number of databases that have been set up. These, with the exception of the FBI report, are all private databases. They are mostly managed by volunteers who read the news and then try and collate all of those mass shootings. The problem is the definition of a mass shooting changes, depends on whether it was injured or whether somebody died from it, and it's not uniform. So as a result, you can see that these databases, which in theory cover some of the same time periods, vary greatly. And so we really don't have a good sense of how many people die of firearm injuries every year. The impact of the Dickey Amendment pretty much is that there has been no good firearm-related research in the past several decades. What you see there is the gray line are gun deaths. The green line, which I suspect you probably missed that, the green line is down here at the bottom because it's 0. The CDC has not spent a penny on gun-related firearm research since the Dickey Amendment came out. Now, to contrast that, the blue line is the NHTSA, the National Highway and Traffic Safety Administration budget. And as their budget has gone up and they have studied auto-related deaths, you can see that right at this point, all of a sudden, automobile-related mortalities have gone down. We learned, for example, that airbags save lives. Okay, how many people in the room would go buy a car today without airbags? I don't see any hands. We've learned from research what saves lives. Okay, we can do the same with firearm-related research if we just apply the money to that. So I'm going to leave you with a very simple question. Are you prepared? Thank you very, very much. I appreciate the opportunity to speak.